face masks to be compulsory in England from Tuesday. Face masks will be compulsory in shops and on public transport in England from Tuesday in response to the new Omicron variant, the health secretary has said. Sajid Javid said PCR tests for all overseas arrivals would be required as soon as possible once agreed by the four nations. The measures would help to ensure that we can all continue to enjoy Christmas with our families, he said. Mr. Javid added he had acted swiftly and in a proportionate way. The government has stopped short of extending vaccine passports in England and issuing advice to work from home, which are part of its Plan B, a contingency plan, if intervention on COVID is needed to protect the NHS. Mr. Javid told Sky News the face mask rules would be implemented on Tuesday, but he hoped all the new measures could be lifted again within weeks. The reason we've set out these measures yesterday is to protect the progress we've made so we can all continue to enjoy Christmas with our families. He said the government would take further swift action in a proportionate way wherever necessary, but he did not think working from home guidance was needed. While he said the reintroduction of PCR tests for travelers was waiting on approval from the four nations, the government website said it would be a requirement from 4 o'clock GMT on Tuesday. The health secretary also said he was expecting the government's vaccines advisors to offer recommendations imminently on changes to the booster program. I want to make an even broader offer of vaccines, especially of boosters, he said. At a Downing Street news conference on Saturday, the Prime Minister called the new measures temporary and precautionary and said they would be reviewed in 3 weeks, just before most schools break up for the Christmas holidays. Labour has called for full implementation of Plan B and for improved sick pay to encourage self-isolation. Boris Johnson announced the restrictions after it was confirmed that 2 Omicron cases had been detected in Brentwood, Essex, and Nottingham. Officials said the cases were linked and connected to travel in southern Africa, where the new variant was first identified. Mr. Johnson said, "We need to slow down the spread of this variant here in the UK because measures at the border can only ever minimize and delay the arrival of a new variant rather than stop it altogether." The government's response is to test everyone coming into the UK, isolate all Omicron contacts, ramp up boosting, and bring back compulsory face masks in some public places. Let's be clear, that will not stop more Omicron cases arriving or circulating. It's already arrived. If a virus is good at spreading, then eventually it will slip through. And it has the potential to spread here too. Cases of COVID have been climbing, except for a lull over the October half-term. They are averaging at more than 40,000 a day, and the R number is just above the crucial threshold of 1. If Omicron can combine faster transmission with some ability to evade immunity, then it too could spread. All the measures can do is buy time, but for what? Science and boosters. In Scotland, Wales and Northern Ireland, face coverings are already mandatory on public transport and many indoor areas. But retail and health workers said the rules on face masks should never have been relaxed, with shop workers union USDA accusing ministers of flip-flopping on basic and sensible COVID measures. Retail staff working with the public every day are deeply worried about catching COVID-19, and the arrival of the Omicron variant is a further concern, said USDA's Patty Lillis. Carol Popplestone, chairwoman of the Royal College of Nursing, said face coverings were something we have already called for, and it should not have been a new variant that forced the Prime Minister to act. One change has already been implemented. 10 countries, South Africa, Namibia, Zimbabwe, Botswana, Lesotho, Eswatini, Angola, Mozambique, Malawi, and Zambia, are now on the UK